I am 62 years old. I live on a beautiful lake north of Charlotte called Lake Norman. I have a husband of 39 years, John, and a son who's 30 who lives in Denver, Colorado. We are a family of engineers. I am a mechanical engineer, which was pretty rare for a woman to go into engineering almost 40 years ago. My husband's a petroleum engineer and our son is a civil engineer.
I was actually a year ahead of Nancy at West Virginia University. Nancy was sitting right behind me, and I tapped my roommate on the shoulder and said, "And that's her," as in that's going to be my girlfriend. And now, 40-some years later, she's my wife.
We are now in retirement land, and we love hiking, biking, and traveling, both nationally and more likely internationally.
Nancy and I have been very fortunate that we really have always been best friends.
Shortly after we retired, we were doing extensive traveling. I think we did most every peak in the Lake Tahoe area. And I noticed afterwards that my heart rate would kind of get stuck at a very high rate. My name is Nancy, and I have recurrent pericarditis.
Pericarditis is inflammation of the sac of the heart. The pericardium is a thin membrane that envelops the heart. It has a number of functions. In particular, it has a mechanical function. It prevents the enlargement of the heart and allows synchrony of the chambers of the atrium and ventricle. It also prevents infection, lubricates the heart.
I woke up at 2 in the morning with this horrible chest pain, a stabbing pain, and I had no idea what it was. The next morning, finally did the dreaded 911 call, which I've never had to do in my life for myself, and got rushed to the emergency room. Naturally, when the 911 folks appear in your living room, you're immediately relieved to know that you're not having a heart attack. But at the same time, you're still in a lot of pain.
When we were in the emergency room, after running a number of tests, that we were informed that she had pericarditis, which was something new to us that we knew very little about.
So I was quite interested to know what I had, and the fact that I had pericarditis meant to me that I had to get educated on what it was.
The main symptoms will include excruciating chest pain, often worse with breathing, often radiating to the left shoulder, better leaning forward, worse lying back, and sometimes they're very short of breath. In the Western world, like at Cleveland, the most common cause would be a viral illness, or we call idiopathic. It could be any virus, in particular the cold virus. It can even be COVID. Another leading cause in the Western world would be post-cardiac injury. For example, if you have open heart surgery, or you have an electrophysiologic procedure, or a PCI.
After about 7 weeks, I had so much anxiety because I couldn't understand what was wrong with me. I was in pain, but I was more weak and pretty much unable to move, which is not at all what I'm like. So we went up to Cleveland Clinic and immediately got admitted. And the very next day I met Dr. Klein and what I started to call his dream team.
The main diagnosis of recurrent pericarditis would be you have the acute attack, it gets better for 4 to 6 weeks and then comes back. And we have certain clinical criteria as well as imaging criteria. The main complications would be constrictive pericarditis, What that means is that the lining gets very, very thick, compresses the heart, and may lead to surgery. The other major complication would be cardiac tamponade, which means that there's a fluid buildup compressing the heart. Both are very serious.
Dr. Klein got me started on what he referred to something along the lines of triple therapy.
In terms of the treatment of recurrent pericarditis, there's a stepwise approach. And step one would be NSAIDs such as ibuprofen, colchicine, which is another anti-inflammatory, and we tell them to restrict their exercise. Step two, if they fail step one, would be low-dose prednisone, corticosteroids. Step three would be the drugs that a rheumatologist may give. And the fourth step would be surgery, radical pericardiectomy. There's a new drug on the market. It's called rilonacept. Rilonacept is what you call a biologic. It blocks interleukin-1 alpha and beta. So it's a very targeted anti-inflammatory. And the way it was discovered or used in recurrent pericarditis was that we did a pilot study in 25 patients, and it dramatically reduced the chest pain and lowered what you call the CRP, an inflammatory marker in the bloodstream. Based on that pilot study, we did the pivotal study called Rhapsody. Rhapsody was a multi-center trial, and it also showed that acute pericarditis was treated acutely and lessened recurrences, improved quality of life, and patients were actually able to get off their steroids.
Shortly after I saw him the first time, all of the fluid around my heart dissipated, predominantly due to the steroids and the weekly injection.
We start with the medicine, but we do recommend lifestyle changes. We often recommend that they go on a diet, perhaps a Mediterranean diet that has some anti-inflammatory properties. And interestingly, we tell them to restrict their exercise, because exercise with a faster heart rate can aggravate pericarditis.
He said to keep my heart rate below 100 beats per minute so that the pericardium, which is 2 layers, would heal and the inflammation would go away.
We want the heart to heal. We almost tell them, the sports analogy, they're on the injured reserve list and they have to keep the heart on ice, and gradually over time they can increase the heart rate.
And as I started thinking about it, if you break your leg, you isolate your leg, and 8 weeks later, you're healed. You can't isolate your heart. It has to keep beating 24/7, 365. So his approach of keep it below 100, Nance, will help it heal. And so that's what I did for 15 months. Of just walking. It was really hard to keep yourself from just getting depressed. I wasn't really prepared for what was gonna happen to my head, because it's an emotional journey, a psychological journey.
Often they may have some depression, trouble sleeping, they're having a lot of chest pain. Perhaps they can't do their job, they may have to go on disability, but they have to follow the advice of the doctor, stay on the treatments. It takes a long time to heal.
You have to give yourself pep talks that you're getting better, you're gonna heal, it's curable.
But in terms of our program, over time, with proper therapy and good advice, it does get better.
I'm the most impatient person I know, so that was another huge part of my journey and just learning to sit still. I go to the Cleveland Clinic every 6 months. I have been fluid-free for quite a while now, but I still have some symptoms of pericarditis.
If I compare Nancy's health today to where it was in those first 3 months or even immediately after the first visit to the Cleveland Clinic, she is dramatically better. Not 100%, but dramatically better.
So the future is very bright, especially with the newer targeted therapy, the biologics may help these patients. So over time, we tell them to be patient, and it does get better over time.
Here you go. So things are going really great now. I started out, I got back on a bike, but I wouldn't mind going back up to the Virginia Creeper, which was phenomenal. And it was kind of funny, I think the first or second ride I did just in the neighborhood, I'm riding along the street and I feel like these tears coming out of my eyes, and I was like, what? And I think it was tears of joy, which I never really believed existed, but now I do. Yeah, this feels great. So I'm very much recovered. I won't say I'm 100% better, but oh my gosh, it's so good to have my life back.